Today's conference will focus on a topic we've never covered before but have received numerous requests for: helminthic infections in the human body and the process of recovery. Many have inquired whether our product, ACTIVIDAN, possesses antiparasitic properties, how it can be used, and for what specific purposes. For this reason, we have decided to explore the subject of post-helminthic recovery during this conference. Why is this important? Although our population is generally well informed, there are over 250 helminthic pathogens known to infect humans, with 50 species being the most common. Helminths are parasitic worms that can enter the body and cause both acute and chronic infections. These parasites harm the body through their toxic substances, leading to conditions such as abdominal syndrome, allergic reactions, anemia, chronic intoxication, and impacting organs like the lungs, liver, bile ducts, and even the brain. Moreover, beyond the brain, the eyes, our primary organs of vision, are often affected as well. In the Russian Federation, worm infections statistically affect an average of 1 to 2% of the population, but in some regions, this rate can rise to 10% or higher. This is a significant and ongoing concern. While helminthic infections are typically managed by infectious disease specialists, the impact of helminths on various organs and systems often requires the involvement of other medical professionals. Pediatricians frequently play a role, as children are particularly vulnerable to these infections. In cases where helminth infections lead to the development of cysts in the liver, lungs, or other organs, therapists and surgeons may be needed for surgical interventions. Additionally, gastroenterologists, dermatologists, allergists, and urologists are often involved. Essentially, nearly all medical specialties can be engaged when dealing with helminth infections. The causes of these infections are well understood in the medical community. The most common helminths include roundworms, nematodes, flatworms, which encompass trematodes, flukes, and cestodes, apeworms. Infections with annelid worms and other similar species are relatively rare. When it comes to roundworms, many of us recall childhood experiences, like those in kindergarten where tests involved inserting tubes into the anus to detect parasites such as ascaris, pinworms, trichinella, and others. Cestode infections, on the other hand, can be more severe, particularly those caused by the beef tapeworm, pork tapeworm, and dwarf tapeworm. In our region, we also encounter bird tapeworms and echinococci. Among flukes, Phacelia hepatica stands out. I've had the opportunity to see these parasites up close, and they have a particularly unpleasant appearance. As the name indicates, this parasite primarily affects the liver and is notoriously difficult to treat. The life cycle of helminths involves several stages of development: eggs, larvae, and semi-mature forms. These parasitic worms may undergo multiple developmental phases, potentially changing hosts several times, or they may remain in a single host throughout their entire life cycle. GeoHelminth infections are typically linked to poor personal hygiene. Consuming unwashed fruits and vegetables, drinking contaminated water, or coming into contact with soil tainted by feces can all lead to these infections. Children are especially at risk since they may put plants or objects in their mouths that have been contaminated by the urine of cats or dogs, or they may inadvertently ingest contaminated soil. Biodelminthic infections involve parasites that require one or more intermediate hosts, such as animals, fish, or insects, to complete their life cycle. These infections are typically contracted by consuming undercooked meat or fish or by drinking untreated water. Such infections can lead to serious health issues and often necessitate prolonged treatment. The third type of helminth infections is contact helminthiasis. These infections spread from person to person through direct contact or by sharing common items like toilets, dishes, and linens, or through self-infection. As a result, maintaining good personal hygiene is crucial in preventing these infections. The classification of helminthiasis is complex, based on factors like the biological characteristics of the helminths, their environmental behavior, routes of transmission, and where they reside within the human body. Helminths can also be categorized by their location in the body. Intestinal helminthiasis occurs when parasites like ascaris and pinworms develop in the intestines, while extraintestinal helminthiasis involves parasites residing in the liver, gallbladder, blood vessels, under the skin, and other parts of the body. Extraintestinal helminthiasis can lead to significant health complications. The symptoms of helminthic infections vary depending on the immune system's response. Typically, the initial symptoms appear following the parasite invasion, with organ-specific symptoms developing once the parasites reach different areas of the body. Helminthic infections can present as acute or subacute conditions, with a duration ranging from 2 to 3 weeks to 2 to 3 months, depending on the individual's immune system status. We are often unaware of when or where we contracted a helminth infection. Symptoms may not appear until 3 weeks to 2 months after exposure, and in the chronic phase, they can persist for several years. The primary pathological effects include toxic allergic reactions, mechanical damage to organs and tissues, and nutritional deficiencies caused by the parasite. Helminths can impede the body's recovery by causing weight loss and vitamin deficiencies due to their absorption of essential nutrients, which disrupts digestion and nutrient absorption. Moreover, the immune system is rapidly compromised. During the acute phase, the most common symptoms include toxic allergic reactions such as fever, skin rashes, muscle pain, and swollen lymph nodes. Severe infections, where the parasite multiplies quickly, can also cause abdominal symptoms like constipation, diarrhea, and abdominal pain. When helminths invade other organs, specific symptoms may develop: bronchospasms, dry cough, and breathing difficulties if the lungs are affected, or enlargement of the liver and spleen in the case of liver infestation. Additionally, the toxins released by helminths and the resulting nervous system damage can lead to autonomic symptoms like apathy, fatigue, sleep disturbances, and irritability. The severity of reactions can vary from person to person. In the chronic phase, organ-specific damage is more prominent, caused by mechanical trauma at the site where the parasite resides. For instance, if the helminth is located in the liver, this will result in liver changes and pain on the right side of the abdomen. In cases of intestinal helminthiasis, symptoms typically include abdominal pain and digestive issues due to impaired absorption processes. This can lead to hypovitaminosis, progressive weight loss, and asthenic syndrome. Intestinal infections are often associated with iron deficiency anemia. Severe helminth infections can lead to serious complications such as rectal prolapse, hemorrhagic colitis, and bleeding due to damage to the intestinal mucosa. These infections often cause bowel obstructions as well. In chronic cases affecting the liver, symptoms may include mechanical jaundice, hepatitis, cholecystitis, cholangitis, and pancreatitis. When infections occur through contaminated water or the genital tract, they can lead to persistent vaginitis, endometriosis, and salpingitis, as helminths may enter the abdominal cavity through the cervix. Symptoms vary depending on the organs involved, and a precise diagnosis should be made by a physician. This diagnosis is based on clinical evaluations, epidemiological data, and specific tests such as serological assays, ultrasound, scintigraphy, colonoscopy, and FGDS, esophagogastroduodenoscopy. Self-diagnosis is not reliable and should not be based on personal assumptions. People with pets, especially children who sleep with them, are at increased risk. Even indoor pets can introduce parasites into the home via contaminated soil or plants, and can transfer parasites through their paws and fur. In an attempt to prevent infections, some individuals may begin using over-the-counter anti-helminthic medications without a prescription. It is important to note that all medications have potential side effects, and anti-helminthic drugs are no exception. These drugs can significantly affect the human body. For helminthiasis, doctors typically prescribe specific anti-helminthic treatments, targeting nematodes, cestodes, trematodes, or using broad-spectrum medications, along with symptomatic treatments, particularly in severe cases. These may include antihistamines, intravenous infusions, vitamin supplements, cardiac glycosides, anti-inflammatory drugs, and in some instances, hormones and glucocorticoids. For severe infections like echinococcus, which can impact vital organs such as the liver, heart, eyes, or brain, surgical intervention is often required to remove cysts or abscesses. When it comes to prevention and alternative treatments, it's important to avoid nonspecific remedies like pumpkin seeds, which need to be consumed over a long period and may cause allergic reactions. Self-medication is not recommended. Comprehensive medical evaluations are crucial. Unconventional methods, such as diagnostic tests using unvalidated devices that falsely indicate the presence of parasites, cannot replace accurate serological tests and other proper diagnostics. Although around 250 helminth species are identified, only about 50 are commonly encountered in humans, and not all of them cause illness. Accurate diagnosis through laboratory tests and thorough medical assessments is essential for effective treatment. Always seek advice from a specialist for evidence-based treatment to ensure full recovery. Preventing helminth infections fundamentally involves maintaining good hygiene, educating about personal hygiene, and preventing environmental contamination with feces. For instance, in many countries, dog and cat owners are advised to use bags and scoops when walking their pets to clean up after them and prevent pollution. Teaching personal hygiene, especially to children, is vital. Furthermore, to prevent biogelminthiasis, it's important to regularly deworm pets and adhere to sanitary regulations for food products, including meat and fish. Regulated markets ensure that food is safe for consumption, unlike informal markets where products may be sold without adequate inspections, posing significant health risks. A personal example: my cousin experienced severe and long-lasting effects after consuming contaminated fish from a region with poor hygiene standards. In areas where food safety is not adequately regulated, the risks are considerable, and treatments can be both complex and extended. Severe helminth infections, especially those involving vital organs such as the heart or liver, often present significant treatment challenges and may necessitate surgical intervention. Infections of the heart by parasites, in particular, are difficult to treat and can lead to poor outcomes. To prevent contact helminthiasis, especially in groups of children, it is essential to disrupt the parasite transmission cycle. This requires rigorous hygiene practices, including regular handwashing and avoiding the sharing of utensils and containers among children. For effective helminth prevention, seasonal use of anti-helminthic medications is advisable, as they are more manageable for preventive care. Additionally, routine parasitological screenings for children and individuals in high-risk groups are crucial. An important factor is the impact on the immune system, which is frequently weakened by helminth infections. Worms with suckers can inflict severe damage by adhering to the intestinal wall, causing bleeding, ulcerations, and tissue necrosis. This can lead to symptoms of systemic toxicity and significantly impair overall health. Treating helminth infections is often complicated and can have toxic effects on the body, putting extra strain on the liver, kidneys, and cardiovascular system. It's important to recognize that parasites consume nutrients from our diet, including monosaccharides and sulfates. For instance, pumpkin seeds, which expand in the digestive tract, are commonly used as a supplementary treatment, though they may have limitations and potential side effects. Treating flatworms with suckers presents particular challenges. Once these parasites attach, complete eradication is difficult, and the worms continue to grow and thrive. Effective prevention and treatment of helminth infections require careful management. Even treatments aimed at short-lived helminths can have a considerable impact. Starting treatment as soon as possible is crucial to protect the body from potential harm. Before a definitive diagnosis is made, using ACTIVIDAN may help reduce symptoms and minimize damage caused by helminths. ACTIVIDAN is believed to support cellular membrane stability and decrease pore size in blood vessels, potentially preventing the spread of parasites. Although no published studies confirm ACTIVIDAN's effectiveness in treating helminth infections, it is speculated that it might influence the progression of helminthiasis in more advanced stages of parasitic development. Post-treatment recovery is also crucial. Cellular detoxification plays a key role in restoring health by converting sulfates into less harmful forms and binding them to blood cells. When cellular damage occurs, processes such as apoptosis and cellular proliferation are necessary to restore normal function and prevent necrosis. Helminths can migrate to various organs via the bloodstream, affecting the skin, liver, lungs, brain, and eyes. To prevent their dissemination, it is important to stabilize the pores and blood vessel walls, where biochemical reactions, including heparin secretion by mast cells, are vital. Helminth infections often spread through microcirculation vessels, making it essential to maintain vascular wall integrity to prevent the spread of cysts during treatment. Supporting the immune system is also critical, as helminths can strain the red bone marrow and other components of the lymphatic system, including the gastrointestinal tract. ACTIVIDAN serves as an effective stimulant for red bone marrow, enhancing the production of white blood cells that are crucial for a robust immune response. It boosts leukocyte production to combat infections while avoiding excessive suppression in cases of leukemia. Consequently, ACTIVIDAN aids in the generation of leukocytes to address infestations. Although white blood cells cannot directly eliminate large helminths, a rise in monocytes and basophils in the blood can signal an active parasitic infection. In such cases, further diagnostic tests, such as stool analyses and serological examinations, may be recommended to detect the presence of parasites and their fragments. As an immunomodulator, ACTIVIDAN helps restore cellular balance and detoxify the body by binding and removing toxic substances. While it does not directly combat large helminths, it helps control inflammation and protect organs and tissues from damage. After treatment for helminth elimination, it is essential to follow an appropriate recovery regimen to fully restore the body. It is recommended to take ACTIVIDAN 2-3 sachets per day for a month to support the healing process of affected organs and systems. ACTIVIDAN helps with tissue regeneration, improves blood and nerve circulation, and stimulates nerve cell growth in affected areas. Helminth infestations require a complete recovery of the entire system, and this process needs to be supported, especially in cases of body exhaustion. It is important to focus on rebuilding body mass and the ability to self-regulate, which are often compromised by infestations. The sulfate monosaccharides in Actividan contribute to rapid cell regeneration and improved cellular metabolism, accelerating the recovery process and promoting body mass growth. These substances are quickly absorbed and provide the necessary energy for mitochondria, facilitating the restoration of body functions. Using ACTIVIDAN can significantly enhance regeneration processes, effectively doubling the efficiency of tissue, blood, and blood vessel recovery. This leads to better blood circulation and increased cellular energy. For complete recovery, an adequate diet rich in proteins and carbohydrates, which supports regeneration, is essential. ACTIVIDAN also helps stimulate appetite and improve nutrient absorption, aiding the healing process. Drinking clean water, ideally filtered or bottled, is crucial, as contaminated water can be a source of helminths. Although boiled water can reduce some risks, purified water is preferable due to the variable crystalline properties of water depending on environmental conditions. Additionally, maintaining a clean environment and breathing fresh air contribute to overall health, although helminths are not commonly transmitted through the air. In conclusion, for complete health restoration after helminthiasis, it is essential to follow recommended treatments, maintain a proper diet, stay hydrated, and ensure a clean environment. Worms can deposit their eggs into the bloodstream through their bites, feeding on their host's blood. After traveling internationally, it's prudent to undergo a parasite check or use preventive medications to safeguard your health, as you might be unaware of potential infections and symptoms can be subtle. Actividan serves as a valuable support for the body, even with mild helminth infestations, aiding in overall health maintenance. It is important to note that some helminths, particularly those with a short life cycle that don't form cysts in organs and tissues, can be naturally eliminated by the body, making them easier to treat. Proper hygiene and preventive measures are essential to avoiding diseases. During the recovery phase post-infection, Actividan is crucial for accelerating the healing process without disrupting the normal function and structure of affected organs and tissues. I advise you to follow good hygiene practices, thoroughly wash food, vegetables, and fruits, and ensure proper heat treatment. Keep in mind that diseases related to poor hygiene, such as hepatitis A, are prevalent. I wish you good health, recommend using Actividan, and say goodbye for now. There are no questions from your end, and today's conference will be brief. With summer ending and the weekend near, I hope you enjoy the upcoming time.